terrifying experience to be in another country and not know if your child's insulin is going to work, and not understand what type of situation you're going to be in if you end up in the emergency room in diabetic ketoacidosis.
Imagine you have a pounding headache, blurred vision, and nausea. You're diabetic and have to make the choice to feel this sick for the next few hours to save up to $3,000. What would you do? It's a position no one ever wants to be in, especially when those symptoms can quickly escalate to unconsciousness. But insulin vials cost up to $3,000, and throwing one away without being absolutely sure it isn't working isn't a feasible solution.
We got to our destination. Her blood sugar kept staying high, up to 500. I changed her pump over and over and checked her blood sugar.
Are you or someone you know diabetic? It's likely the answer is yes, since 11% of the US population has diabetes, more than 1 in 10 Americans. And it's likely that this problem will affect each and every one of them. This is because insulin is very temperamental, has a strict temperature range, and must be refrigerated to prevent spoilage. Manufacturers rigorously control insulin delivery to pharmacies and patients' homes using refrigerated packaging and temperature monitoring. But this is where the control ends, as users are left to fend for themselves for the remaining months they have to store their insulin. What would you do if your power went out and with it your refrigerator? Would you guess and take your insulin anyway? When you start feeling the headaches, the nausea, how long would you spend troubleshooting before you part with the insulin you need to stay alive? What if this is your only insulin vial? What if you relied on insulin donations from a low-income clinic and had no idea how this insulin had been stored before you received it, and no idea if it had been spoiled?
That's where SpoilerALERT comes in. We're making a lateral flow immunoassay. In short, a COVID test for your insulin that allows you to see whether your insulin is working correctly or not right at home. It saves time and money, helping to streamline the troubleshooting process and ensuring that no one ever throws out a good vial of insulin again. It is easy to use and cost-effective. Just place a small sample of your insulin onto the test pad and get rapid visual confirmation that the insulin in your vial is working correctly.
As insulin costs have risen 11% annually from 2001 to 2018, the average cost for a diabetic patient comes out to around $6,000 annually. With around 1.5 million people in the United States living with type 1 diabetes, this means that $8.7 billion or $725 million are being spent monthly on insulin. Insulin manufacturers recommend that you store your insulin between 36 and 46 degrees Fahrenheit. And they've also reported that improperly storing your insulin at temperatures higher than this range can result in a decreased potency between 14 and 18% by the end of the month. Other reports have shown that 25% of insulin users don't adequately store their insulin within this temperature range, and 98% of insulin users have been known to travel without maintaining a proper cold chain. By providing insulin users with a mechanism to test their insulin prior to use, we aim to help patients manage their blood sugars effectively, as well as reduce the amount of unnecessary waste of expensive insulin supplies.
When insulin denatures, the protein unfolds, producing amyloid fibrils. Our test aims to detect these fibrils at a concentration that would render insulin ineffective. That way, the user knows when to stop using a vial. Our test uses simple lateral flow principles, where a hydrophilic wicking pad produces capillary flow through the assay. When a small sample of insulin is placed on the sample pad, the insulin flows to the conjugate pad, which contains conjugated antibodies. These are a complex of gold nanoparticles bound to mobile anti-amyloid antibodies that the denatured insulin will bind to. A positive test result with the test and control lines visible means that sufficient amyloid fibrils were detected to indicate that the insulin is ineffective.
With an effective test device that would be the first and only of its kind, SpoilerALERT aims to give diabetics control and confidence in their medication in the moment they need it.